Good afternoon, everyone. Thank you for joining Curis System today to learn about a case study that was performed in conjunction with Georgia Healthcare Coalition Region K, Children's Healthcare of Atlanta, Phoebe Putney Memorial Hospital, Dougherty County EMS. Today, we will learn about mitigating transmission by maximizing disinfection resources in response to the COVID-19 pandemic. Today's presentation is presented by Julie Miller of Phoebe Putney Emergency Preparedness Coordinator, Region K, Vince Battaglia, Curis System Supplier, myself, Frances Grinstead, founder of Curis System, and Megan Hislop, Senior Research Biologist at Curis System. And please, my apologies, Julie Miller was not able to join us this afternoon due to the constraints of the current COVID situation. She is very busy and unable to attend, but has contributed greatly to this presentation and contributing greatly to the current climate and to help overcome that. Thank you, Julie, for doing that. And Megan is going to take it from here. Megan, can you explain to us a bit of the science that is involved in this case study?
Thank you, Frances, and hello, everyone. Just to begin with, we're going to set the stage a little bit here. We're going to go back to before the COVID-19 pandemic. Vince, what can you tell us about the preparation and the organization of the Healthcare Alliance in that pre-pandemic time period?
So 2015 to 2019, CDC made available a $1.7 billion grant responding to the Ebola outbreak. That funding that was broken down to the emergency management of each state. In the fine verbiage of it, it stated to treat Ebola or Ebola-like outbreak. The requirement by CDC was it had to disinfect against Ebola and one level above disinfecting Ebola. So 15 regions, emergency management in the state of Georgia. 2 of the regions purchased a product that was to what the letter said. It disinfected Ebola in just one level above. 13 of the 15 regions looked at a product, the Curis disinfecting fogger, and realized that it disinfects against hard spores like C. diff. Their thinking was, well, if we can get this for Ebola and meet the Ebola requirement, but it also satisfied future needs should we have an outbreak of C. diff, measles, yellow fever, what have you. So they were looking at it viewpoint, well, let's get this because it meets the letter for Ebola, but it also addresses any other outbreaks we may have in the future. Next slide.
Now, Vince, I know that you did a lot of training at that point. What can you tell us about training all of these various organizations that are part of the Alliance, and then also the tools that you were training them on?
Right. The Curis fogger is a very mobile disinfectant system. You can use it as a fogger, a spraying system, or you can port the disinfectant into a small confined area. So it was very versatile in the hospital environment, from the stairwells to the ORs to ERs, and ventured to other industries like EMS and nursing homes. But as far as, I think training was pivotal. Once they got the funding, they got the equipment on the ground, Julie Miller asked me to come down, and I said, I'll give you 5 days of training. My thinking was, let's do training in the morning so I can get your night shift and day shift. And then I'll do it again that afternoon and get another part of your day shift and then next shift. So I could be at 5 locations covering 2 or 3 different shifts. Well, she took it a step further. She goes, Vince, could you not give a class at one hospital in the morning, and would you mind going to hospital B in the afternoon? And I said, absolutely. So instead of getting 5 hospitals, I ended up training 10 different hospitals in a 5-day span. Within that, I noticed early on, luckily, I overheard a comment from one of the infectious disease nurses was, this is going to stay in my office until I have a policy. And being in the healthcare industry, I knew exactly what that meant. You got to write a policy. It's got to get approved. Since I knew the system and the training and operation of it, that night I literally wrote a policy on how to use the disinfectant fogger. It wasn't the policy, but it was a policy that had most of the meat, and they could tailor it to each individual hospital and their needs. Next.
Thanks, Vince. I know that policy is key to getting things rolling. One of the memorable things that I remember Julie Miller saying is that when they were looking for that disinfectant equipment, she wanted to find something that would kill this bug and the next. Meaning, even though the available funding was due to Ebola, the Healthcare Coalition thought to stretch that funding to be able to counter even more difficult pathogens. That's what this list on the left here is showing you. You may be familiar with Dr. Spalding's classifications. This is a ranking of pathogens by their type, and it goes from the easiest to inactivate towards the bottom. It's the easiest to inactivate on a surface, all the way up to the hard to inactivate ones on top. So you can see that the flu here is on the bottom, where Ebola also fits as an enveloped virus, and even coronaviruses. Becoming more difficult as we go up, we have gram-positive and gram-negative bacteria, such as staph. That includes the antibiotic-resistant MRSA, Pseudomonas, which can also be antibiotic-resistant, up to the non-enveloped viruses, such as neurovirus, and the very hard-to-kill bacterial spores, such as hospital superbug C. diff. This is why Curis fit the bill for Georgia's Healthcare Coalition. The Curis system uses Curoxide, which is a hydrogen peroxide-based sporicidal disinfectant. The Curis system is on the EPA's list N, disinfectants for use against SARS-CoV-2, and also on the EPA's list K for efficacy against that hard-to-kill bacterial spore, C. diff. To be on that list, the Curis system passed the EPA's most stringent test to date, which measures efficacy through a 3-part soil load, which mimics how pathogens can be protected by bodily fluids, so very much like what we would see in the real world. Not only is the level of pathogen on Dr. Spalding's hierarchy important, but also the degree to which the system you are using is effective. So you can see in the bottom right corner, if we started with 1 million organisms, a 3-log product or a 99.9% product can leave 1,000 organisms alive. But moving upward as efficacy increases, a 6-log product such as Curis is 99.9999% effective, leaving less than one of those hard to kill spores behind on a surface. All right, now I want us to think back to the beginning of March 2020. The pandemic was starting to get a foothold in the US, but cases of COVID-19 were mostly still in isolated pockets. You might remember seeing headlines from that time period that there was a well-attended funeral in Albany, Georgia, which unfortunately turned into a super spreader event. Well, all of that was happening in Region K of Georgia's Healthcare Alliance. This chart that you see here is from the Georgia Department of Public Health. I'm sure you're familiar with the R0 of a disease, which is a number that tells us the potential for how many people can get sick from a single infected individual. If that number is high, the disease can spread rapidly, and if it is low, then it may spread more slowly. For COVID-19, the CDC estimates that the R0 is somewhere around 2.2 to 2.7, or about spreading to 2.5 people from each infected individual. However, the actual real-world conditions can also influence that disease spread, and we call that the RT for the rate of transmission in that moment in time. Well, in Albany, Georgia, and the surrounding area, at the start of March 2020, that RT was reported to be 4.5 to 5, meaning each sick person is infecting up to 5 others, which is a pretty quick rate of spread and hard to get ahead of. Facing this high-level outbreak, the Georgia Healthcare Coalition went into action. What this slide represents is the Healthcare Coalition's reach throughout their community. With this central hub of resources and training, you can follow the arrows here to see how the healthcare network was able to reach out to each important sector, and also how the sectors shared resources with each other, such as between the EMS and the hospitals or the EMS and the long-term care facilities. This interplay is really critical to the overall pandemic response. Vince, can you walk us through what you and the branches of the Healthcare Alliance went through at this time?
Right, thanks, May. So the ER found it very beneficial to be able to use it in the ER without closing down the ER. They could basically turn an ER room within an hour because of the simplicity of the fogger. They are able to share it with the EMS as they came in if they had a certain protocols, the ER would share their fogger with the EMS service while they were turning the ambulance around and delivering their patients. But it was also very beneficial to use in the stairwell, the elevators, the lobbies, and eventually moved to their vaccination sites. Next slide. The EMS services using it after seeing success with the hospitals purchased a few of the foggers, and they were able, this particular EMS service was able to keep their absentee down to 4%, while the surrounding community absentee was 37%. They also learned not only could they disinfect their ambulances, but they did the bunk room. So A shift wasn't sharing with B shift, and B shift wasn't sharing their viruses with C shift. They used it in their administration offices and their common areas, as well as gyms and bathrooms. This particular EMS service to date, since January 21, has disinfected their ambulances over 353 times recorded. Next slide. The EMS community also shared their foggers initially with the long-term care because the nursing homes were hit so hard, devastating our senior community. They simply would move the individual living in a room to an open area, maybe outside, to get some fresh air, and they would disinfect the room. They could do that in about 30 to 45 minutes. They do 2 or 3 rooms at a time, and then they would just leapfrog, moving a few people out throughout the living space and disinfecting their rooms, moving them back in. Next slide. The community then realized, they could take us out of hospital in the EMS community and use it in public areas, schools, daycares, funeral homes, even vaccination tents. This is a device used in a rural, economically disadvantaged region that helped essential personnel in essential locations remain open, including vaccination tents. One thing I thought was genius with all the vaccinations they're doing, or while they're doing testing, also those tents as well. They had 2 tents, tent A, tent B. Tent A would be their vaccination or their test tent. Tent B would be their rehab tent, where the healthcare workers could take a break, get into shade and cool off a little, get some cold water. Every hour or so, they would stop and they would flip the tents. The tent that was doing the vaccinations or the swabbing, they would put all their equipment down to the vest that they're wearing, the orange reflective vest or the labeling vest that were identifying the personnel. They would put it all into tent and disinfect in about 20 minutes, then open that tent up and continue. So they were to continually operate between 2 tents, in between disinfecting their equipment in the tent actual sites. Megan?
Along with the outstanding response from the Healthcare Coalition, some other early adopters either were already using Curus or quickly brought the technology on board. You can see here the police department in Albany, Georgia, disinfecting one of their squad cars. And then that other photo on the bottom is the West Virginia National Guard. They set up a drive-by station for ambulances to be disinfected after carrying any patients suspected of having COVID-19. These organizations were really tremendous at mobilizing their forces and reaching out to their communities to offer aid. I'm going to wrap up at this point, taking a final look at what elements were the most important here. The preparation and advanced training put together by the Healthcare Coalition in combination with already having efficacious tools on hand in the Curus system meant that the Healthcare Coalition members didn't have to organize and train and research what resources were available. The critical components here were already in place. The foresight to be smart about the Ebola funding when it was available, maximizing the purchasing power here really paid off. By looking to the future to tackle this bug and the next, as Julie said, this really set up the Healthcare Coalition regions with supplies when many other locations across the country were on waiting lists or hindered by the supply chain delays. One particularly impressive element here is that get-or-done attitude that had flexibility to meet the evolving needs of the pandemic. Instead of being limited by the situation or the supplies, the right attitudes towards teamwork led to situations such as a COVID-positive patient's room being disinfected, and then the same device being brought downstairs to disinfect the ambulance. Even a suspected outbreak at a community church and the Curus equipment being loaned out to help there. There are a lot of small but impressive moments that happened because of the community coming together when it was needed. We can never underestimate the importance of prepared leadership. Prepared leadership brings consistent messaging and effective actions that can lead to a strong outcome. Showing that steady leadership makes it easier for everyone to follow, especially in these emergency times, and it enables that cohesive community function that we've seen here. And lastly, but certainly not least important, communication was key, particularly that the communication network was already established through the teamwork of the Healthcare Coalition, allowing for all of these individual emergency response groups to work together to serve their community as a whole. Thank you so much, everyone, for joining us to hear about the great work that was done here in Georgia and with the Curis system. This has been mitigating transmission by maximizing disinfection resources in response to the COVID-19 pandemic.